Good afternoon. Today we will look at how the procedure of major autohaemotherapy therapy is performed. It consists of several stages: blood collection, ozone treatment of the blood, and returning the blood to the patient. For this, it is advisable to perform the procedure in a treatment room, following aseptic and antiseptic rules, as well as blood handling protocols, though it's not as complicated as it might sound. To carry out the procedure, a sufficiently large gauge catheter is inserted into a vein and connected via a three-way stopcock to a syringe filled with heparinized saline solution, to prevent blood clotting and the formation of thrombi. Some of the solution is injected into the patient's vein, and then a transfusion set and a blood collection container are connected to the three-way stopcock. A plastic bag or a saline bottle can be used as the blood collection container. The transfusion set is connected to the bag, with one needle inserted into one of the bag's ports and the other end connected to the three-way stopcock. For a partial major autohaemotherapy therapy session, collecting 100 to 150 milliliters of the patient's blood is sufficient. In principle, larger volumes can be used, but 150 milliliters is quite enough. By switching the three-way stopcock, the system is flushed with heparinized saline, and some of the solution flows into the bag. Then comes the blood collection stage. The three-way stopcock is switched, blood is drawn into the syringe, and then by switching the stopcock again, the blood is transferred from the syringe into the bag. Major hemozone therapy itself is one of the oldest procedures in the ozone therapist's toolkit. Worldwide, several million such procedures have already been performed. The procedure is very straightforward and at the same time one of the most effective. It allows for fairly high dosages and has a powerful systemic effect. At the same time, it is quite safe. Ozone therapists around the world actively use this procedure, and internationally it is considered one of the most widely used, arguably the leading procedure for systemic therapeutic impact. It has several modifications, including versions that use vacuum bottles and systems. Vacuum bottles allow for efficient blood collection from the patient, but they also increase the overall cost of the procedure. At the moment there are certain difficulties with sourcing vacuum bottles, so we suggest a simpler method using readily available components with a three-way stopcock. The next step is filling the syringe with the ozone-oxygen gas mixture. In this case, the Metazone's Pro Ozonator is used. It allows operation in the range of up to 60 milligrams per liter. Using a Janet syringe, we draw the ozone-oxygen gas mixture from the ozonator through a filter. 100 to 150 milliliters of the ozone-oxygen gas mixture is sufficient. Once sufficient volume has been collected, press the stop button and close the valve to stop the flow. The syringe can then be disconnected from the device. After disconnecting, attach a needle to the syringe. The tubing should be wiped with a disinfectant solution swab. To prevent any leakage, prepare a clamp. Insert the needle into the tubing, release the clamp, and administer the required volume. It's quite easy to calculate the dose the patient receives. In this case, a concentration of 5 mg per liter was used, and 150 milliliters of ozone-oxygen gas mixture was administered. The patient therefore received 750 micrograms of ozone. This is not a particularly high dose. It can generally be considered stimulating and activating. After administration, a clamp is applied to the tubing. The syringe is then disposed of. The blood bag is gently rocked and turned to increase the surface area of contact between the gas and the blood and to mix it thoroughly. Blood is naturally suited for contact with oxygen, and ozone is an activated, highly reactive form of oxygen, so the interaction occurs quite quickly. A minute and a half to 2 minutes is sufficient for adequate contact to occur. The blood warms slightly and a small amount of foam appears, after which it can be rainfused into the patient. Since it is the patient's own blood, there is no need to perform EBOO or RH compatibility testing, biological testing, or individual compatibility checks. It can be administered right away. This can be done through a transfusion set. The process can be sped up by using a 3-way stopcock and a syringe. Draw blood from the bag into the syringe, switch the stopcock, and push the blood from the syringe into the patient's vein. It's best not to press the plunger too forcefully, so as to minimize damage to the red blood cells and preserve their lifespan. The procedure is quite fast. In the hands of a skilled nurse who has already mastered it, it takes about 15 minutes. We return the blood to the patient fairly quickly, and we begin monitoring both before and after the procedure. It makes sense to measure blood pressure. If vascular tone has decreased and blood pressure has dropped somewhat after the procedure, the patient should rise gradually in stages to avoid orthostatic changes. Before the procedure, to help improve vein visualization, the patient may be offered 200 to 300 milliliters of hot tea. This will make it easier to access the vein. The procedure itself is quite powerful and, as you can see, takes very little time. It is one of the most powerful tools available to an ozone therapy practitioner.